Hi, I'm Kelly Busby. I'm from Kingwood College, and we're going to talk about respiratory care department. We're going to talk about ippb treatments. This is an ippb machine. It happens to be a Bird Mark 7, but there's a PR2 made by Bennett, which is an excellent machine also. And there's some newer types of ippb machines. When we're giving an ippb treatment, it is, even though this is a ventilator, what we're actually doing is we're doing a sustained maximal inspiration, just like with an incentive spirometer. And we want the patient to get at least 15 milliliters per kilogram. So 15 to 20 milliliters per kilogram is an excellent tidal volume with this. We're actually going to measure the tidal volume with this, and I'm going to put the spirometer right here, which measures volume. I'm going to put it in the exhalation port so that when the patient exhales, we're going to be able to collect the volume. I'm going to take that off right now. It's just a little heavy. Now this circuit goes back to the machine. The machine is fixed into the wall at 50 psi, and it goes into the machine. We have the main line, and then we have the nebulizer line that if you notice, this tees into the nebulizer cup to run the nebulizer, and then the other line goes into the exhalation valve, and it runs a mushroom valve. During inspiration, this valve is closed, so the gas has no place to go but to the patient. Then during exhalation, when there's no gas running down these tubes, this gate is open and the exhalation can occur out here. Obviously, the patient could exhale out their mouth, but when we're measuring, we're going to ask the patient to exhale through the machine, and it doesn't go all the way back into the machine. It just makes this corner and goes out here, and then we're able to measure it with the spirometer, or we'll measure it with a device that's made especially for measuring volumes for the ippb machine. And what we do is we fill the bag up, and however many puffs it takes to fill the bag up, we would breathe. If it takes 10 breaths to fill the bag up, this is 480 tidal volume. If it takes one breath, it's 4,800 tidal volume. Now I do body weight 60 kilos, so I need about 900. So if I get a volume of between 1,000 and 1,500, that will be fine for me. I set the sensitivity on this side, and I want to set it to where when I pull back on this machine to trigger it, it's a -2. Remember, we take -5 to breathe in. We want -2 on this because we want it less work breathing than you normally breathe spontaneously. So when I set this, I've got my flow turned on, and I've got the pressure set at about 12, and I'm going to take a breath now, and I'm going to check the negative pressure and see if the sensitivity is set correctly. Okay, I pulled it back about -2, -3, which is fine. I'm not crazy about my flow rate. I'm going to make my flow rate a little bit faster. And this is as fast as this particular one goes up. That's better. I needed to relax. What you want to see is this little manometer line goes up to the pressure, to the peak pressure where pressure limits off, and pressure cycles off, and it goes up to the pressure and stops, and then the breath stops as soon as it hits this 15 or 12 or 15 where I had it set. Now, this patient is getting an FiO2 of air mix right now. I could move it to 100%, and when I do that, you're going to notice two things. The flow rate goes down, and because we have pushed this in and we're not using the entrainment device, the FiO2 is now 100%, but because we've lost our entrainment device inside here, it's going to be less noisy. So listen to this. My inspiratory time needs to be 1 second, and with the air mix, with the 100% in, I've lost my flow. My flow went down, so I'm going to take this back out, and I want to have an inspiratory time of 1 second. Okay, this is about inspiratory time of 2 seconds. This is as high as I can get this particular flow rate on this machine right now, so this will have to do. Now, for an ippb treatment, we need to have a breath rate of about 6 to 8. To get 6 to 8 breaths a minute, what I'm going to do is 1 second in and 9 seconds out, so that's going to be 10 seconds. So 60 divided by 10 is 6 breaths. If I wanted 8 breaths a minute, I could hold off a couple of less breaths. I have a tidal volume, which we're going to measure. I'm going to put the spirometer in the exhalation port, and I'm going to measure this on exhalation. And I have a tidal volume of about 1,000, which is more than enough. Now, it's very difficult for a normal person to get the tidal volume down to where it needs to be because I have healthy lungs. If I had a low compliant lung, I had pneumonia, I had atelectasis, I would actually need higher pressures to get this volume in. Now I'm going to take the treatment the way it should be taken. Okay, that's how an ippb treatment should be given. If I wanted to measure, I would have the patient exhale through this, but they can't exhale through their mouth if they need to. Okay?